What is the first step when assisting a resident who begins to choke while eating? A. Call 911 immediately. B. Perform abdominal thrusts right away. C. Ask the resident, "Can you speak or cough?" D. Lay the resident flat on the bed. Answer: C. Before intervening, the CNA must check if the airway is partially or completely blocked. If the person can cough or speak, encourage them to continue. If they cannot, abdominal thrusts are needed. Which of the following best prevents infection when providing perineal care? A. Using warm water only. B. Wiping from front to back. C. Using gloves only if necessary. D. Drying before washing. Answer: B. Wiping from front to back reduces the spread of bacteria from the anal area to the urinary tract, which is essential to prevent infections such as UTIs. A resident with dementia begins wandering toward the exit door. What should the CNA do first? A. Restrain the resident in a chair. B. Gently redirect the resident to a safe activity. C. Call security immediately. D. Lock all the doors. Answer: B. Redirection is the safest and least restrictive intervention. Physical or chemical restraints are avoided unless absolutely necessary. When assisting with range of motion exercises, which principle should guide the CNA? A. Perform exercises quickly to finish on time. B. Move joints until the resident feels mild resistance or discomfort. C. Stop if the resident complains of pain. D. Only exercise the stronger side. Answer: C. ROM exercises must never cause pain. Stopping at the first sign of pain prevents injury and respects the resident's tolerance. Which method is correct for verifying a resident's identity before giving them a meal tray? A. Ask the roommate to confirm the name. B. Check the tray ticket against the resident's wristband or care plan. C. Ask the resident, "Is this your tray?" D. Serve trays in room order without checking. Answer: B. Matching the tray with identification ensures the right resident receives the correct diet, which is essential for safety and medical care. What is the best position for a resident who is at high risk of aspiration during meals? A. Supine at 0 degrees. B. Fowlers at 90 degrees. C. Side lying flat. D. Trendelenburg position. Answer: B. Upright sitting, Fowlers, at 90 degrees reduces the risk of aspiration and promotes safer swallowing. When donning PPE for contact precautions, what is the correct sequence? A. Mask, gown, gloves. B. Gown, gloves. C. Gloves, gown, mask. D. Gown, mask, gloves. Answer: D. The correct order is gown first, then mask, then gloves to ensure protection and minimize contamination risk. What should the CNA do if a resident's oxygen tubing becomes disconnected from the oxygen source? A. Reconnect it if trained and notify the nurse immediately. B. Ignore it because the nurse will notice. C. Replace the tubing independently. D. Remove the oxygen device completely. Answer: A. Reconnecting tubing is within CNA scope if trained, but the nurse must be notified to assess the resident's oxygen status. When transferring a resident using a gait belt, where should the CNA stand? A. Directly in front of the resident. B. On the resident's weaker side. C. Behind the resident. D. On the resident's stronger side. Answer: B. Standing on the weaker side provides support and stability, reducing the risk of falls. A resident suddenly complains of chest pain and shortness of breath. What should the CNA do first? A. Provide a glass of water. B. Help the resident lie flat. C. Stay with the resident and call for the nurse immediately. D. Walk away to get the nurse quickly. Answer: C. Staying with the resident while activating help ensures safety and provides reassurance during a possible emergency. Which action is most important when helping a resident who has orthostatic hypotension? A. Have the resident stand up quickly. B. Encourage the resident to hold their breath when standing. C. Assist the resident to rise slowly from lying to sitting, then standing. D. Avoid hydration before movement. Answer: C. Moving gradually allows the blood pressure to adjust, reducing dizziness and risk of fainting. If a resident is on seizure precautions, what item must be readily available at bedside? A. Tongue depressor. B. Suction equipment. C. Electric heating pad. D. Ice packs. Answer: B. Suction equipment is essential to clear secretions and maintain an open airway during seizures. A CNA notices a fire starting in a resident's room. What is the first action? A. Extinguish the fire immediately. B. Rescue the resident and move them to safety. C. Call the fire department directly. D. Open the windows for ventilation. Answer: B. According to race protocol, the first step is to rescue anyone in immediate danger before trying to contain or extinguish the fire. How should a CNA properly dispose of a used razor blade? A. In a regular trash bag. B. In a sharps container. C. In the resident's bathroom cabinet. D. Wrap in paper and throw away. Answer: B. Sharps containers are specifically designed to prevent accidental injury and protect staff from bloodborne pathogens. Which of the following is the best way to prevent falls in residents with poor vision? A. Keep hallways clear and well lit. B. Lower all bed heights to the floor. C. Have residents stay in bed at all times. D. Place furniture randomly to slow them down. Answer: A. Clear, well-lit pathways allow residents to navigate safely and independently, reducing fall risk. When applying restraints, what is a CNA's responsibility? A. Tie restraints to side rails for quick access. B. Apply restraints as tightly as possible. C. Ensure quick-release knots are used and check circulation. D. Use restraints whenever a resident is agitated. Answer: C. Restraints must allow blood flow and be secured with quick-release knots for safety. They should only be applied under a nurse's direction. What is the correct response if a resident with diabetes refuses a meal? A. Respect the refusal but notify the nurse immediately. B. Force the resident to eat small bites. C. Ignore it since the next meal will come soon. D. Offer double portions at the next meal. Answer: A. Food refusal in diabetics can cause dangerous changes in blood sugar. Reporting ensures appropriate care. Which steps should always be taken before using a mechanical lift? A. Ask the resident to lift themselves partly. B. Ensure the sling and lift are in good working condition. C. Use the lift without checking the weight limit. D. Skip safety checks if in a hurry. Answer: B. Equipment must be inspected to prevent accidents and ensure safe transfers. Which vital sign change requires immediate reporting? A. Temperature 98.6 degrees Fahrenheit. B. Blood pressure 120/78 mmHg. C. Respiratory rate 8 breaths/min. D. Pulse 72 BPM. Answer: C. A respiratory rate of 8 is dangerously low, indicating potential respiratory depression. Immediate action is required. Why is it important to lock the wheels on a wheelchair before transferring a resident? A. To keep the chair steady and prevent movement. B. To remind the resident not to stand up. C. To save time during transfers. D. To balance the resident's posture. Answer A. Locked wheels keep the wheelchair stable, reducing the risk of falls during transfers. When should hand hygiene be performed during resident care? A. Only at the beginning of a shift. B. Before and after each resident contact. C. Only if hands look visibly dirty. D. Only before meals. Answer B. Hand hygiene before and after each resident contact prevents the spread of infections, even if hands appear clean. It is the cornerstone of infection control. A resident is placed on droplet precautions. Which PPE is essential for the CNA? A. N95 respirator. B. Surgical mask. C. Shoe covers. D. Lead apron. Answer B. Droplet precautions require a surgical mask to prevent the spread of infections like influenza or meningitis through large droplets. What is the safest way to ambulate a resident who has hemiplegia? A. Support on the stronger side. B. Support on the weaker side. C. Stand directly behind the resident. D. Allow the resident to walk unaided. Answer B. Standing on the weaker side provides support and stability, helping prevent falls during ambulation. If a resident is found on the floor, what is the CNA's first action? A. Immediately lift the resident back to bed. B. Call the nurse and stay with the resident. C. Leave to get help without staying. D. Scold the resident for not using the call light. Answer B. The CNA must never move a resident after a fall until assessed. Staying provides reassurance and prevents further harm. When measuring blood pressure, which mistake can cause a false high reading? A. Using a cuff that is too large. B. Allowing the resident to rest quietly. C. Placing the arm at heart level. D. Using a cuff that is too small. Answer D. A cuff that is too small compresses the arm more tightly, leading to an inaccurately high blood pressure reading. Why should residents with dysphagia be monitored closely during meals? A. They are more likely to eat too fast. B. They are at risk for aspiration. C. They usually refuse food. D. They may overeat. Answer B. Dysphagia, difficulty swallowing, increases the risk of food or liquid entering the airway, which can cause aspiration pneumonia. Which statement is true about using bed alarms? A. They prevent falls completely. B. They notify staff if a resident is attempting to leave the bed. C. They can replace regular rounds. D. They are only used at night. Answer B. Bed alarms alert staff to possible unsafe movements, but they do not replace supervision. They are a safety aid, not a guarantee. What is the correct action if a resident refuses vital sign measurement? A. Record estimated values. B. Respect the refusal and report to the nurse. C. Force the resident to comply. D. Skip documentation completely. Answer B. Residents have the right to refuse care. The CNA must document refusal and notify the nurse so the situation can be addressed appropriately. What should a CNA do if they notice a resident's identification band is missing? A. Replace it with a temporary handwritten band. B. Notify the nurse immediately. C. Ignore it unless medication is due. D. Ask the family to confirm the identity each time. Answer B. Missing identification bands compromise patient safety. The nurse must be notified immediately so a new one can be issued. Why is it important to encourage residents to use call lights? A. To keep CNAs from entering the room unnecessarily. B. To promote safety and timely assistance. C. To avoid accidents with wheelchairs. D. To remind them about their daily schedule. Answer: B. Call lights allow residents to request help promptly, reducing risks of falls or other injuries when attempting tasks alone. A resident is receiving oxygen through a nasal cannula. What is a CNA's primary responsibility? A. Adjust the oxygen flow rate. B. Ensure the tubing is not kinked and resident is comfortable. C. Change the humidifier water daily. D. Refill the oxygen tank as needed. Answer: B. CNAs do not adjust oxygen flow rates but must ensure tubing is functioning properly and the resident remains safe and comfortable. Which is the safest practice when feeding a resident with one-sided weakness after a stroke? A. Place food on the weaker side of the mouth. B. Place food on the stronger side of the mouth. C. Alternate sides with each bite. D. Feed only liquids. Answer: B. Placing food on the stronger side helps the resident chew and swallow more effectively, reducing aspiration risk. How often should residents be repositioned to prevent pressure ulcers? A. Every 2 hours in bed and every hour in a chair. B. Once per shift. C. Only if redness appears. D. Every 6 hours regardless of position. Answer: A. Frequent repositioning prevents skin breakdown and improves circulation, which is critical for immobile residents. What is the correct action if a CNA finds a resident with water spilled on the floor nearby? A. Report it but wait for housekeeping. B. Leave it for the next shift. C. Clean it up or mark the area immediately. D. Ignore it if no one is near. Answer: C. Immediate action prevents slips and falls. Either cleaning or blocking off the area ensures safety. Why should CNAs avoid using electric blankets with residents? A. They may not keep residents warm. B. They increase the risk of burns in residents with poor sensation. C. They cost too much electricity. D. They are difficult to wash. Answer: B. Residents with impaired circulation or sensation may not feel heat and can suffer serious burns without realizing it. If a resident with a hearing aid does not respond when spoken to, what should the CNA check first? A. If the hearing aid is turned on and working. B. If the resident is ignoring them. C. If the resident needs new batteries from family. D. If the resident prefers not to communicate. Answer: A. A simple equipment check ensures the hearing aid is functional before assuming other causes for non-response. What is the best position for a resident after tube feeding? A. Supine at 0 degrees. B. Fowler's or semi-Fowler's position. C. Trendelenburg position. D. Prone with head turned. Answer: B. Keeping the head of the bed elevated reduces risk of aspiration and promotes proper digestion. When documenting care, what must a CNA always remember? A. Use only personal shorthand for efficiency. B. Record facts accurately and promptly. C. Document care before it is performed. D. Skip documentation if care was minor. Answer: B. Documentation must be accurate, objective, and timely to ensure legal and clinical accuracy. What is the CNA's role if a resident is scheduled for a diagnostic procedure? A. Explain the risks of the procedure. B. Provide emotional support and assist with preparation. C. Obtain informed consent. D. Perform the procedure if the nurse is unavailable. Answer: B. CNAs provide comfort, explanation at the basic level, and help with physical preparation, but not consent or medical procedures. Why is it important for CNAs to maintain professional boundaries with residents? A. To keep residents from becoming too dependent. B. To prevent favoritism, protect privacy, and ensure ethical care. C. To avoid additional workload. D. To reduce personal stress. Answer B. Professional boundaries protect both residents and caregivers, ensuring care remains respectful, safe, and ethical.